Chelsea, Massachusetts is the state's smallest city, and it's one of the most diverse, long drawing both immigrants and industry. With that industry came pollution, contributing to the city's significant health challenges. Chelsea was bankrupt 2 decades ago. Now it's filled with lush gardens, new schools, and thriving businesses. Little Chelsea is in an enormous turnaround, with leaders and residents uniting to clean the air, make the streets safer, and improve health for everyone.
Historically, Chelsea struggled from a culture of corruption and lack of faith in local government. It has risen from those ashes to really become an extraordinary city.
People organized and took over local government so that it would be run by the people and be the powerful community-led city that it is today. Chelsea has tackled environmental justice issues for over 20 years now, and residents are dealing with some really significant health challenges, and we strongly believe this correlates with environmental burdens like air emissions, noise pollution. Residents are at the forefront of this fight for environmental justice.
The retrofitting of the machinery at the Produce Center was a great example of a collaborative effort between a local industry and Green Roots to reduce their air quality impact by retrofitting a lot of the trucks and some of the exhaust areas, and really made a huge difference in the air quality.
Residents are challenging some of the polluters. They're challenging government to be more accountable to the residents of Chelsea.
El derecho a la vida.
The Environmental Chelsea organizers are a team of young people who implement environmental justice campaigns and projects.
I'm ready, let's go.
People are going to be able to show up and canoe here. They're going to be able to see how acidic the water is, to see if it's safe.
When adults see youth being super engaged in our community, it shows them that they should be an active resident and do everything that they can and fight with the youth. We have to make sure that we're doing everything that we can so that that future that we want is the future that we get.
So welcome to the Neighborhood Walk. Today is our last Neighborhood Walk for the summer.
Increasing the social capital and the cohesiveness of the communities, it's very essential in order to create great neighborhoods.
The neighborhood developers are building new neighborhoods in areas that used to be industrial or vacant and turning those areas into places where there's strong social cohesion and a strong sense of community.
Hi, do you prefer English or Spanish?
A lot of the folks that live in our community are disenfranchised, are very vulnerable, and oftentimes they don't know how to exert their rights in our community. So it's always good to bring them to the table so that they can be part of the change that is happening.
If you ever have ideas on how to make our community safer, you can always come out.
We believe that if our community is a space where people feel welcome and they feel heard, then folks can thrive in it.
We're a city of immigrants, and we want this to be, in terms of a welcoming city, a welcoming police department as well. Enforcing laws are essentially a small part of what we do. It's really just being out there and working with people constantly.
Through a partnership of numerous different organizations in the city, together with the police department in the city of Chelsea, we have these navigators that are going out into the community and working with those who are most impacted by substance abuse or homelessness and other challenges.
I'm the community navigator. My job is to help people.
We realize that if we can have individuals that would actually go out into the street and engage these folks, we could connect them to the very things that they were missing. Sometimes it was just someone to talk to.
We're trying to be open-minded and try to give them the help that they need, other than just arrest.
I get to know them. I establish a relationship. I build a trust. You know, I buy them something to eat. And if you want, we can try to help you guys find a place. Whatever issues they may have, whatever services they may require, it's my job to try to get them there.
People need to be connected with others, and that's how we're going to be able to get people back on their feet.
One of the great organizations that we have here in Chelsea is ROCA.
We have a young men's program and we have a high-risk young moms program. So both groups of youth are at high risk. They usually fall through the cracks, and this is where we come in. So tonight is family night. It's an opportunity for all the moms to get together with their children, take classes that they need, and the whole aim is to help them get themselves out of poverty.
RWJF does a lot. These are the individuals, a lot of them that come from broken homes. A lot of them come from other countries. A lot of them get very, very attracted to the gang life. Without an organization like RWJF, our community would really be put at risk.
They know when they come to RWJF that we really care about them. They cannot do anything that would keep us from getting to them and helping them in their lives.
A lot of the community members that live in the city of Chelsea do not have a documented status, and just because you're undocumented does not mean that you do not have rights.
The Chelsea Collaborative is really key in ensuring that the most vulnerable and marginalized residents are empowered and engaged.
We have the Socio-Economical Justice Department, which works in workers' rights, tenants' rights, and also we have the Youth and Families Department. We have the Immigration Department, which helps with immigration clinics, citizenship, pro bono attorneys for immigration issues.
In today's day where immigrants feel so at risk, our sanctuary city status helps members of our community to feel safe, to feel welcome.
Regardless of your place of origin, your religious background, or your immigration status, you're welcome in Chelsea, and we're happy that you're here.
The school department is working collaboratively with many different community-based organizations and health institutions to ensure that the entire district is trauma sensitive. So many of our students are coming from different communities and different countries that have seen so much violence, and to see the school department welcome them and make sure that they have the services that they need to be successful students and to move on to be successful adults is something that I'm really proud of in the city of Chelsea. One of the reasons that Chelsea is becoming so successful is that we have a comprehensive and collaborative approach to change. The Hub is a place where a number of different community-based organizations and healthcare providers come together with the police department, and they talk about specific and immediate cases.
Risk factors are homelessness, substance abuse.
The Hub is probably the most innovative thing that we do. They meet once a week, and then we look at issues of individuals or families that are highly at risk. We mobilize teams on who can intervene, and then the next week we provide a quick update on whether that the risk factors were reduced or removed, and then we move on.
We're the champion of silo busters. The idea of it, all of us together, breaking down those walls, sitting in the room together, talking things out, has really gone a long way. And I think it just makes Chelsea a more vibrant and a healthier city overall.
Mass General Health Center, the Chelsea campus here, is a backbone of health and wellness for our community.
Part of Mass General's mission is to improve the health and well-being of the diverse communities we serve. We have 45 community health workers that speak 21 different languages. Community health workers really address the barriers to care for individuals in this community, which could be transportation, child care, family issues, fear.
Community health workers, they're the gateway to everything. For example, if it comes to healthcare, the community health worker help the patient to get service and care. Because of the community health workers, there's less emergency room visits or urgent care visits, because now patients are following with their doctor and they have appointments.
What are the conditions you think that are actually setting up these behaviors that are leading us to the outcomes?
Healthy Chelsea was a coalition of multiple different community stakeholders and partners working to advance health initiatives in the city.
We'll continue to ask for your amazing feedback.
Just a few years ago, the coalition worked collaboratively with the Board of Health to pass the most ambitious trans fat ban in the entire nation. In Chelsea, in restaurants and bakeries, there is absolutely no trans fat used in the products.
We use multi-sector partnerships to really address obesity within the community. The school system has been a big partner with both healthy eating and active living work, and as a result, they have reduced sugar intake, they've reduced sodium intake, which is fantastic.
Chelsea's on the right track. Our community could sit back and say, woe is us, or we could continue to fight and persevere and be the powerful city that we are.
The people, they're fighters, every one of us.